And one of the things that I have consistently seen over and over and over again is a lack of physical exams, orthopedic physical exams from the physicians. There's a lack of orthopedic physical exam findings. The ones that are in there are extremely basic. Hey everybody. So the last few weeks I have had quite a number of out-of-state patients come to see me for regenerative injections for their chronic pain. And this has prompted me to make this video because of something that I have seen over and over again now that I believe is extremely problematic and may be part of one of the reasons why we have a huge epidemic of chronic pain in this country. And to give you some back information on this, when a patient comes to work with me, one of the things that I'm doing is I'm reviewing their past medical records. That's going to include, procedures that they've had done, imaging that they've had done, physical therapy sessions that they've had done, because all of that information is really critical for me to have an understanding on, what's been done, what hasn't been done, what the thoughts of other physicians were. What imaging studies have been done, what they found, what they didn't find, all that kind of stuff. And one of the things that I have consistently seen over and over again is a lack of physical exams, orthopedic physical exams from the physicians, okay? Whether that's an MD or a DO, doesn't matter. There's a lack of orthopedic physical exam findings. The ones that are in there are extremely basic. I'll give you an example for a low back, a patient coming in with low back pain. I may do, range of motion, which, you got flexion, extension, side flexion, lateral or rotation. So you got 6 exams right there. Then the muscle testing around that area, there's maybe 8 of them. So now we're at about 15 tests, and then orthopedic testing, probably there's going to be about 10 that I'm going to do. So right now we're at 25, and then some neurological testing. So anywhere from 20 to 30 exams that I'm doing, or orthopedic tests that I'm doing to try and ascertain where the pain is coming from with this patient. And most of the time what I see from other physicians in the conventional realm is on average maybe 6 to 8 tests. And that is nowhere near anything close to what we need in order to really identify what's contributing to the pain. And on top of this, the other thing that I notice is the physical therapy sessions. Those have the in-depth physical exams and orthopedic testing that we need to start seeing out of physicians. It is obviously phenomenal that the physical therapy world is doing a killer job, and obviously there's going to be a range of quality within the profession. But in terms of the actual profession as a whole, I believe they're doing a phenomenal job at doing the in-depth physical exams that are required to help identify what's contributing to the pain. But from the physicians who are doing injections, who are doing surgery, I don't see that level of in-depth physical exams. And I think that leads to a lot of unnecessary injections, unnecessary surgeries, inappropriate referrals, inappropriate medications, and what we now have today, which is a chronic pain epidemic, which has led to the opioid epidemic and just a lot of patients who are suffering in pain. And so the scaling back here to try and give you guys value, if you have chronic pain and you have been working with providers who have not done a thorough enough physical exam, meaning they spent at least 15 minutes just doing the physical exam, and after that physical exam, they can talk to you about what their thoughts are on what structures are contributing to your pain, not just okay, now let's get an MRI. If you haven't had that yet, I strongly encourage you to seek that out, whether that's from another physician, whether that's from a physical therapist, it doesn't matter. I think having that physical exam is an important step in the process, because what happens then is when you can identify which structures are potentially or likely contributing to your pain, it becomes much easier problem to address because we can be more specific with our therapies. That doesn't mean it has to be an injection therapy. There are still other ways to address pain that is coming from, that we know is coming from the supraspinatus tendon or the sacroiliac joint. If we just think of it as low back pain or shoulder pain, our treatments are not as specific and may completely miss the mark. But when we can get more specific, that does help us in our approach for treatment. All right, everybody, I hope that this video helps at least one person resolve their chronic pain. And I'd love to hear your thoughts and your experiences with physicians, physical therapists, chiropractors, anybody else in terms of your pain and physical exams. See you later.